Welcome to Community Health Matters. I'm your host, Amy Marsalis. Today on our show, we'll hear about the potential impact of health care reform on Tennessee children, student nutrition, and a new online resource to connect people to care. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. And Dr. Deanna Bell is my first guest today, and we're tackling a really complex issue. We appreciate you coming in to discuss this and its relevancy to the children of our state. We're talking about the Affordable Care Act, and there's so much attention on this. Obviously, it is extremely timely in our nation's capital as the debate continues. What is the American Academy of Pediatrics most concerned about within the context of this very important debate in our country?
You're right. It is a very important debate right now. Really, as the voice of Tennessee's pediatricians, the American Academy of Pediatrics is most concerned about the impact the changes in our healthcare financing could have on the children of our state. Of particular importance to us are the cuts that have been proposed for the Tennessee Medicaid program. Right now we're at an all-time high in terms of the rates of children's health care coverage in Tennessee. 96% of children in Tennessee have some form of health care coverage or health care insurance right now. And we really don't want to see those rates drop. And we're very concerned that the proposed cuts to Medicaid could result in a lot of children losing their health care insurance.
So can you tell us a little bit about why Medicaid and the Children's Health Insurance Program, which we know is HealthCare and Cover Kids here in our state, why those programs are so important to the kids?
These programs are absolutely vital to the children in Tennessee. There are 870,000 children in Tennessee who are covered by Medicaid.
Wow.
And there are 100,000 who are covered by Cover Kids. So HealthCare and Cover Kids together insure nearly 1 million children in Tennessee. This includes half of the kids in Tennessee who are under 5 years of age. It includes half of the children in Tennessee who have some sort of chronic health condition like cystic fibrosis, cancer, sickle cell anemia. And it includes 75% of the children in Tennessee who are at or near the poverty level. So these services are absolutely vital to their coverage. And as we know, developmental problems and different diseases are treated best if they're detected early.
Early intervention.
Right, early intervention is essential. And these programs provide comprehensive health screenings, physical exams, developmental screenings, vision and hearing screenings, dental screenings, to help detect those problems in children. And when a problem is detected, these programs pay for the medically necessary services to treat the children. So they're absolutely essential to the care of the kids.
Treating them early, getting them on the right track, preventing more serious issues down the line potentially.
Exactly. And it's been shown that these children end up having fewer days out of school. They're more likely to graduate from high school, graduate from college, have better, higher paying jobs that pay taxes back into our system. So really, Medicaid and CHIP, or HealthCare and Cover Kids, they don't just treat the problem of today, but they really invest in the productivity and the health of our population years down the road.
All right, obviously covering these kids and vulnerable populations is important, but there are also the budgetary concerns and the impact from covering large numbers of these children. Why are these cuts unnecessary?
Well, right now, Medicaid is set up in Tennessee such that the federal government and the state government both contribute funds based on the number of people who need coverage and what it takes, how much it costs to cover them, how much their health care costs. Right now, the federal government contributes about $2 billion to the coverage of Medicaid patients in Tennessee, which is about half of what Tennessee receives from the federal government in total. So with the proposed Medicaid cuts, or really it's a cap, with the new legislation, they're proposing a cap, which would say, okay, Tennessee, you've got a certain amount of money to cover all the people who need to be covered, and there's no additional funding based on the number of people who need coverage. And historically, when we've seen this done in other states, the states typically have changed the eligibility requirements such that fewer people are covered. They don't make up those funds from other places. They typically cut the eligibility requirements, and so fewer people are ultimately covered. And that's a big deal because half the people on Medicaid in Tennessee are children. And so if they change the eligibility requirements, a lot of children will lose their HealthCare insurance, which is sad because even though they make up half of the Medicaid population, they only take 20% of the Medicaid resources.
Interesting.
So they're a relatively inexpensive body of people to cover.
I see, okay. So what happens if the cuts go through? What can the state of Tennessee do?
Well, like I said, most likely they would change the eligibility requirements.
Okay.
That's by far what most states have done. But it would probably also lead to an increase in taxes, or they could pull funding away from other programs such as education, public safety, or public infrastructure. And that's typically what other states have done before when they've gone to a cap system.
So why should employers or Tennesseans not covered by Medicaid care about these cuts, in your opinion?
This is a problem for all of us to address. When people are uninsured, they don't receive their preventative health services, and so problems are detected later when they're more expensive to cover, and people generally seek their health care through the emergency room, which is more expensive. And that in turn places the burden of the cost of insurance or cost of care to employers and to people who have private insurance, families who have private insurance. So really cutting Medicaid is a short-term solution to a long-term problem.
All right, well, thank you so much for shedding light on this very complex issue and speaking on behalf of the organization.
Thank you so much for having me.
All right. Enjoy the rest of your summer.
All right, you too.
Thank you. And we'll be back with much more of our program right after this. And we're talking with our next guest about kids and good nutrition for our students. And it's hard to believe that summer is just rolling along and kids will be back in school before we know it. Spencer Taylor is our next guest. Good to see you, Spencer.
Thanks for having me.
Oh, absolutely. So with school around the corner, what exactly does your nutrition services department do?
Overall operations, purchasing, hires for our department, professional development and training for our employees, and most importantly, developing our menu and cooking all the food that we serve in all of our schools and metro schools.
And oh, how those menus have changed. I know since I was in school, I don't know about you, but for me, it's just, it's come a long way.
Sure it has.
A long way. So tell us how the menus are put together, how they're created, and what kind of guidelines metro schools follow.
Well, we take most of our insight from USDA, National School Lunch and National School Breakfast Program, in that those guidelines are what govern all programs around the country, in which there are certain requirements on proteins. We have to offer milk, the incorporation of fruits and vegetables. There are restrictions on calories per age group and serving sizes. So they're pretty much, so they give us the framework in order, and then we have to try to find creative ways to work within that framework to make our meals tasty and appealing to our students.
That's the challenge, isn't it?
A big challenge.
Yeah, appealing in a visual way.
Right.
And something that they will consume. So why is it so important? I think, we know as adults it's important to start our day with a good breakfast, and I would think it would be even more critical for our children to start the day right with nutrition, and then to continue that process with the afternoon with the meal at lunch.
Yes.
Explain that to us,
Well,
why it's critical.
A lot of research is out there that shows that when kids are well fed, they're ready to learn. It's a more disciplined environment, and just overall, kids don't have to think about that human human nature aspect of hunger. And that's just not something that has to be a part of their day. If they're fed, whether they get to school or whether they're able to have a school breakfast at their school, it just further prepares them for the day.
And there are concrete findings, aren't there? There have been studies done that show that children are far more productive when their belly is full and full of good, nutritious food.
Lots of information out there to support that. And that kids they just tend to do better. And the research supports that. I mean, there's always an opposing view, but what we find that our kids are more satisfied when they either have access to breakfast or we provide access to breakfast.
Okay, so you do have breakfast for the kids?
We do.
Okay, and that's across all metro schools?
We offer breakfast at all of our metro schools.
Okay, I didn't realize that. What are some ideas for healthy snacks that the parents can get involved in preparing for their kids that they could take with them?
Well, I would say probably the easiest thing to provide that would be nutritious for kids would be fresh fruits and vegetables. And because you're talking about high nutritional value, low calorie, and there's hopefully enough variety out there to where parents can find a fruit or vegetable that their child prefers or likes over the others. I know sometimes that these can be a picky point with students.
It can be tricky to
can
navigate those fruits
very,
and vegetables.
It can be very tricky. It can be very tricky. But so there may have to be a lot of testing in that category. I mean, of course, there are some other low-calorie snacks. There are nuts and things like that also have a higher nutritional value. But we do understand that our parents come from different backgrounds, and parents have to do their best as they determine for their children.
It can be tough because it's so much easier to grab prepackaged foods a lot of times.
It can be.
And those tend to have oftentimes more sugar or more salt, right?
That is
higher
correct.
sodium.
Absolutely.
So you would prefer obviously the fruits and vegetables. Okay. So do you have some tips, I'm sure you do, on how to get the kids to eat these fruits and vegetables without totally disguising them?
As a parent or as a professional?
Well, both. Okay, as a professional.
Well, they kind of intertwine because I'm a parent myself, and what I would say is that parents it has to be like a family commitment. It has to be mom and dad or a caregiver or guardian has to be all in and involved in that process so that children see modeling at home. And then once they see that modeling, I think that it's good to go grocery shopping. Kids come along to the grocery store, and we spend some time in the aisles that have the fresh stuff, the fresh bright colored things, fresh fruits and vegetables in this case. And as a family, make a decision to see what would you be interested in, what would you try. And I think that's the best way to kind of get children involved in that process. I think as a professional in what we do, we have an obligation to provide these things and offer kids items, and we listen. There are sometimes since we are governed by our standards, there are some things that we won't be able to eliminate totally, but we have to offer fresh fruits and vegetables. And if we see that items are less favorable to kids, we try to incorporate other things. For example, or the techniques. For example, we find that elementary kids don't do very well with whole fruits, or items that have to be peeled because little fingers are not as strong, not as dexterous, or you may have a child that maybe they're starting to lose their teeth. So we find that cutting them up into smaller pieces makes them easier to consume for them.
Just brought back a memory. My mother would always peel apples for us when we were little, cut up apples. And after school, that's what we'd have. It was a great snack.
Sure.
It's a great memory, and it was very healthy, apple a day, right?
Right.
So what are some foods kids should stay away from completely?
Well, I'm kind of from a generation where of moderation, and so
instead of denying, it's like a diet.
Exactly.
That's like a bad word, right?
So what I would definitely say that, and I'd say this as a dietitian as well, is that there are high sugary snacks, refined sugars, highly processed items. There are some items that are going to be processed, but then you're going to have to become educated and start reading labels and determine how many calories are in there, how much fat, how much sugar, how much salt. So I won't bedevil all process items because they're not all created equal.
All right. All right. Okay, we could talk on and on about this, but I appreciate a lot of these tips and insight from you, Spencer. Thank you so much for coming on the program.
Thanks for having me. I really appreciate it.
Okay, and we'll be back right after this. The Safety Net Consortium with Carol Westlake is a part of has been around for a while, Carol, but this new website, I mean, is brand spanking new.
It is brand spanking new.
All right,
yes.
so
Yeah.
let us learn more about this.
I will be happy to do that. Well, the Safety Net Consortium of Middle Tennessee has been around for about 15 years, and it really is an alliance of clinics here in town, providers, the local hospitals, community groups. I actually work for the Tennessee Disability Coalition, so I serve on the consortium as somebody who wants to make sure that people with disabilities have access to good health care, for example. And the Safety Net Consortium established the Bridges to Care program years ago that was sort of operationalized by the health department. So it really are community members coming together to say, how do we make sure that everybody in Nashville and Middle Tennessee has access to affordable, quality health care? And as a part of that, we have a new website that's called My HealthCare Home. And it really is a web-based service that is trying to link people who are uninsured or people who have who are underinsured, whose insurance may not cover regular health care visits, to a source of affordable quality care. So they have a source of regular care and can, as your earlier guest, Dr. Bell, said, really be well and not have to rely on going to the doctor only when it's an emergency or only when you're already pretty sick.
So you're talking about even preventative
Absolutely.
care and
Yes.
taking care of things before they escalate
Exactly.
to a critical situation. How do people get to you? How are you getting the word out besides this program? How are people going to find out about this?
Well, we're doing it in a variety of ways. I mean, one is we have pretty deep roots in our community because of the groups that are part of the consortium, and so everyone's trying to share the word. Our clinics are all doing their individual work to try to make sure that people know that they're out there. But our research shows that about half of the people who are uninsured in Nashville don't know that there are safety net clinics, that there are clinics that have sliding scale fees, and that they can really get affordable care. So we are doing things like this program. We are also really trying to reach out to small employers and helping that maybe can't afford to provide health insurance for their employees or their employees' families, and letting them help us get the word out to folks. Because most people who are uninsured, frankly, are working, but for one reason or another can't afford to have health insurance.
You're talking too about a lot of these people that are underinsured.
Absolutely.
Maybe they're working part-time.
Yes.
Or again, working for a small business where they don't provide benefits. Who would benefit from this information? Those underinsured people?
Yeah, and people without insurance. I mean, we think that everybody in the community would benefit from knowing that there are these services out there that they can be linked to. For example, you might have some decent health insurance, but you might not have dental insurance. Some of the clinics that are part of the safety net are also provide dental services on that same sliding scale fee basis. And so that really is another way, your teeth really are the key to your health in many ways.
Are, yes.
And so if you can go to the website and kind of put in the service that you need and be able to find that near you.
What can people get from My HealthCare Home?
They can find out where the clinics are in their community. They can find out what those clinics provide. They can find out what the hours are. In many cases, the website will link them right to that clinic where they can make an appointment, either online or by clicking and making a phone call right then. So it's really a way to get folks simple and easy. Everybody has a smartphone these days, and the easiest way to find those services.
So the services that these clinics affiliated with you, they provide then a wide variety of services, and maybe somebody getting a tooth filling replaced. It could be having their eyes checked. It could be just across the board.
Right. I would say that all of the clinics that are part of the safety net provide kind of primary care, the kinds of things you would get from your general practitioner, right, or your family doctor.
All right.
And that's really what these clinics want to be. is that regular source of care, right? So that you don't just go when something's wrong.
So almost a first line of defense.
But that you have a relationship with a doctor. It's somebody who you can call, somebody who you know, and who knows you. So disease management, you know, most of the clinics have pediatricians. Some of the clinics have specialists that are on staff. If they are not on staff, there's a part of the Safety Net Consortium called Project Access that can link folks to volunteer specialists who help low-income folks get linked to specialty care when you need a urologist, for example, or you know, you are diagnosed with cancer, and how do you get into oncology and that sort of thing. So there's links to those through those clinics as well.
Will folks receive the same level of care at one of these affiliated clinics that they would from their regular provider?
Absolutely, absolutely. These clinics have top-notch staff, very well-qualified folks who are committed to wellness in this community, are committed to the practice of medicine and really wanting to make sure that people are well. These clinics don't just serve people who are uninsured. Most of our clinics also take patients with insurance. They take them with Medicaid, take them with Medicare, with private insurance. So it's not just a fallback, but it is a safety net for folks who need it.
Terrific. How do people find out more about this then, Carol?
Best thing to do is to go to the website.
All right.
Yeah.
Which is?
Which is my HCH for Healthcare Home, myhchtn.org.
That's terrific. And I want to go back to your roots in the community as we wrap up this segment. You started, you said, 15 years ago. And how did it start, really? It was.
Well, it actually started because there was a national opportunity to get a grant, to get some money to come into our community to try to make sure that we were reaching out to folks who were uninsured or underinsured. And so couple of the hospitals came on, the safety net clinics. Some of them are faith-based, some of them are like FQHCs, they're federally qualified health centers, came together and said, how can we do this as a community? Got some nonprofit folks together, and off we went. That developed a new program. It served thousands of people over the first couple of years. We were able to put care coordinators in emergency rooms. Trying to divert people from emergency rooms was a big part of it.
Well, it speaks to the dedication of so many people like yourself to those people who don't have the access or don't have enough insurance and all of that. So Carol, I think we need to go, but thank you so much for explaining this to us and making us aware of this new
Thanks
website.
for having me.
Thank
Appreciate
you.
it.
All right. We'll be right back. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.